Hello, welcome to chapter 3. Today we are going to talk about the integumentary system. Just kind of as an overview, the integumentary system has to do with your hair, your skin, your nails, anything that's associated with those. So let's get started here. So we're going to look first at the functions and structure of the skin. So the main functions of your skin is protection. Your skin is this physical barrier that's going to protect you against injury, chemicals, ultraviolet rays, microbes like viruses, bacteria, and toxins like maybe formaldehyde, acetone for those of you who use nail polish remover. Your skin actually can't protect you from that. It protects you from a lot of things, but not that. But it does try to do its best to protect you from many different things going on around you. Your skin is water resistant. We don't swell up every time we take a bath because our skin is this water resistant. It also prevents water from leaking out of the body tissues. So there's a lot of things. Our skin has this way to help keep water in and prevent water from leaving. We have little fat granules in the cells in our skin that help to repel water because fat and water don't mix. If you've ever put oil in water when you're cooking or baking, that oil and water, that oil kind of stays in those little droplets. They don't come in contact with each other. So our skin utilizes that same concept to provide water resistance. Your skin regulates your temperature. There's a lot of capillaries, which are really, really small blood vessels found in your skin. They can open up or dilate, make them larger when the body is too hot. And this helps to release out heat. This is what causes your skin to turn red. This is also what causes you to start sweating. When the body is too cold, those capillaries that are close to your skin surface, they can close up or constrict, where they decrease blood flow. This is what helps to keep blood in the body, and the colder it is, more blood vessels or capillaries close off, and this is helping to keep your blood to your vital organs to keep you alive, like your heart, your lungs, your brain. When it's really cold, that's something your body automatically does. Vitamin D synthesis. Yes. In 15 to 30 minutes of direct sunlight a day, your skin can make vitamin D. Vitamin D helps to maintain your bone growth and strength, and it's used for maintenance for other areas of the body. Sensation. We have lots of nerve endings found in your skin. They're going to detect touch, pressure, hot, cold, pain, vibration, and injury, pain sensation. Well, tissue injury, which sends those pain sensations. We have these found all over our entire body, but we have more found, say, in your fingertips, which is what allows you to feel soft, your face, your palms of your hands, the soles of your feet. That's why when you step on something, it's particularly painful. Those of you who've stepped on a Lego or something, those really do hurt. The nipples and the genitals both also have ample amount of sensory receptors. excretion and secretion. Water and different waste products that your cells use or are byproducts from that cell metabolism, we're able to get rid of those through our skin, through sweating. We have other types of glands. We have oil glands. Those are attached to all of our hair follicles, all of our hairs. Helps to keep your skin soft, your hair soft. Your skin also participates in social functions, because your skin is going to reflect those different emotions. Blushing, if somebody's self-conscious, going pale when somebody is frightened or even sick. People go pale when they're sick as well. And wrinkling when somebody doesn't like something. You ever smelled something that caused you to kind of wrinkle up your nose? That's your skin participating in that specific function. So here is our skin and the different layers of our skin. Your skin is the largest organ in the body. It is considered an organ because your skin receives more care and treatment than any other body system. Your skin, which includes all of this area here, is known as the integumentary organ system. Integumentary system. This is your skin, your hair, your nails, those sweat glands that I mentioned, and sebaceous glands. So let's look at some of these pictures, some of these things that are happening in here. Because here, that's with this coming up to the skin surface, that's a sweat gland that I had mentioned. This is a hair follicle because that hair comes up above the skin. See all of these little blood vessels in here? These are these little blood vessels, these little loops even. These are what'll dilate and open up to allow sweat. Here, that's a nerve ending. Here's some nerve endings. We've got lots of different kinds. Here's nerves that are attached to a hair. Nerves are going to attach to your hairs. That's why it hurts when you pull a hair out. We've got these different kinds of sweat glands. So I mentioned one, I mentioned this one. We have this sweat gland in here. Then we have these sebaceous glands. That's what I was missing when I was looking before. These glands right here that are attached to hair follicles. It's considered a follicle because there are cells that are reproducing down here at the bottom. This area in here, they're reproducing to allow your hair to grow longer. So let's look at the difference between a biopsy and an autopsy. A biopsy is the removal and examination of living tissue. Autopsy is the removal and examination of dead tissue. So a biopsy is living. That autopsy is dead tissue. The suffix opsy means to view. And bi, that root, means life. In Greek, the word autopsy means to see with one's own eyes. Carcinoma. Carcinoma is a cancerous mass. So they develop frequently in the skin and travel or metastasize to other areas in the body. When something metastasizes, pieces of that specific mass or tumor, the more common term, will break off, get into the bloodstream, travel somewhere else in the body, leave that bloodstream, attach somewhere else, and continue to grow. That's what it means to metastasize. The prefix cryo. This prefix cryo is freezing. Cryo means cold. We're freezing. It's used in skin surgery. It's used in injuries. If you've ever put ice over swollen red skin, that's where you are using what is known as cryotherapy. Cryotherapy is that using cold or that freezing of that tissue to prevent further swelling. Cryosurgery, another term, that is using freezing devices for skin surgery. Maybe they're freezing off some moles, some possible cancerous tissue. That's where they would use this cryosurgery. So dermatology is the study and treatment of the integumentary system. It's not just the skin, so it could deal with the hair, could deal with the nails. A dermatologist is the person who studies the diseases and treats the diseases of the skin. Dermato, which is that root word with the combining O, dermato, is skin. Dermis and epidermis. Dermis, this is derived from the Greek word for skin. It is let's come back up here. It is this middle or second layer of the skin here. So this area specifically from here to here, this is considered that dermis. That dermis lies below that epidermis. The epidermis, epi means above. So epidermis, above the dermis. It is the outer layer of the skin. So that dermis meant skin. Then that epi meant above. So above the dermis. This is that outermost layer. This is the layer of skin we can see. And epidermal means pertaining to the epidermis. Cutaneous means pertaining to the skin. So here we're still pertaining to the skin. It is considered that cutaneous membrane, that outside layer that we see. Cutane is that root with that E, that combining vowel, is another combining form that it again is going to mean skin. Progress or and diagnosis. They have a different prefix, but they have the same gnosis, which means having a knowledge about a condition. So prognosis, that we have listed right here. Prognosis is having knowledge about a course of a condition or treatment. If you've ever been to a doctor, ever, I know this doesn't pertain to the skin, but having a cold, a common cold is pretty common. So they have a prognosis of about how long that cold will last. Same with different skin conditions. That's why we're looking at it here first. We'll see it pertains to other areas, but we see it here. Prognosis of a skin condition, they have a general idea of how long this condition may last. That prefix in there, pro, means before or project forward. The other word that I had mentioned, diagnosis, is identifying an illness. So, dia means complete. So here we can identify and give a complete diagnosis. We're 100% sure at what is happening. So let's look at the epidermis. The epidermis is our outermost layer of the skin. This is the layer that we see. We have the outermost layer, which is the stratum corneum. This is technically the layer of the skin that we do see. This is dead cell. It says dead keratinocytes. They're named, these cells specifically are named keratinocytes because they make the protein keratin. That's what makes your skin tough. Since these cells are dead, there is no nucleus in these. These are the cells that shed off all day long. We lose up to like 1 million cells every day. Dandruff. Dandruff is considered clumps of these cells in that stratum corneum. They're stuck together with sebum. Sebum is the oil that those sebaceous glands that are connected to those hair follicles, those oil glands, that oil being secreted out is clumping those cells together. And that clumping of those cells, as they slough off, produces that dandruff. The stratum lucidum here, this clear layer that I'm coloring green, This is only found on the palms of your hands, your fingers, and the soles of your feet, the bottom of your feet. This is an extra layer that helps to make your skin more tough. The other layers of this epidermis here, these cells have a lot more keratin protein. We have this stratum granulosum. It's named granulosum because there's a lot of these little dark granules found in here. These dark granules, remember how I mentioned those little those little fat granules really that keeps water in when we're protecting our skin and prevents water from seeping in or prevents us from losing water? That's the stratum granulosum. We have the stratum spinosum and the stratum basal. That stratum basal is the layer of cells that are replicating over and over and over again, because as we lose this top layer of the stratum corneum, we need more cells to replace it. We have other types of cells in our skin as well. Melanocytes, they produce melanin. These cells make your skin color. The melanin that these cells make absorbs UV light, because that UV light from the sun can damage your cell's DNA. When the DNA gets damaged, that's when abnormal cells start to be produced. So this melanin that makes your skin color prevents your cells from being damaged. But that's what also causes your skin to get darker in the sun, because those cells are going to produce more of that melanin in sunlight to help absorb those UV rays. We have tactile cells. These are sensory cells that allow you to feel that touch. And then we have dendritic cells. These are like immune cells that are kind of out wandering and monitoring in case your skin gets torn or damaged to prevent any pathogens from getting into your skin. So, keratin, melanin, and sebum. Let's start with keratin. Carrot means hard protein. That hard protein and keratin, it's present in your hair, your nails, and your skin. And then we have melon. Melon is going to mean black. So this is a pigment, a color that is found, again, in your skin, gives you your skin color. Your hair color is produced through those melanocytes that produce melanin. And even the back of your eye, there's a layer in your eye that has melanin that helps to absorb sunlight into your eye. And then our last word here, sebum. Sebum is Latin for tallow or candle wax. That is that waxy oil that gets secreted from those sebaceous glands into Your hair follicles, again, that makes your hair soft and your skin soft. Intradermal, this is going to be within the, whoops, I talked about spelling counting, epidermis. Subcutaneous, below the skin. Intramuscular. Intra means within, muscular, muscle. And transdermal, going across or through the skin. So when you have some sort of injection, be it a vaccine, some kind of shot, people who are type 1 diabetic and need to give themselves insulin shots, allergy shots, people who have done that. That's a needle that goes transdermal, goes through the skin to be injected into the body. A lot of them are actually done intramuscular. So that needle is sent into that muscle to be injected into the system. Subcutaneous, they can do injections just underneath the skin. If you've ever had a TB test done, allergy testing done, those are done subcutaneously. So transdermal applications. These are medications that are placed directly onto the skin. And then that medication is going to diffuse or go across that epidermis and enter into the blood vessels that are found in the dermis. These medications are placed on special semi-permeable membrane material that allows for a slow absorption of this medication through the skin. So there's certain cardiac medication that they will do transdermal, birth control patches, nicotine patches, and there's also hormone replacements, such as testosterone patches. These are all different patches. Even anti-seasickness or anti-nausea medications, people who get motion sickness, they'll put a patch behind their ear. And this patch behind their ear is preventing those symptoms of motion sickness. So adipose and lipid. Adipose has that suffix "-ose". That "-ose" means full of. And adipo, or adip, sorry, means fat. So adipose means containing fat. Fat does have positive effects in our system. We use fats to help insulate our body, protect both our organs and our bones. We have these little fat pads around our knees. So if you fall and land on your knee, should be a little fat pad that you land on that's helping to protect from injury. We also have a fat pad behind our elbow. So if you hit the back of your arm on a table, you're hitting a fat pad. Your eyeballs sit in fat as a cushion because it sits in a very bony area, so it needs some kind of cushion from that bone. Lipid. Lipid is from the Greek word fat. So it's kind of a general term that we use for all types of fatty compounds. Analgesic. We have our root word. Our root means pain. We have the prefix an means without. So analgesic is a substance that reduces or relieves the response to pain. Follicle. Follicle comes from a Latin word that means small sac. So it's a mass of cells, a big group of cells that are containing a cavity or a small cul-de-sac, such as a hair follicle. Go up and that hair follicle. So this right here, it is a sac of cells through here that has a cul-de-sac, or it has that opening in the middle that this hair fits into. That's where that hair follicle comes into play. There we go. Hypodermis. Hypo, that below, dermis, skin. So this is a tissue layer of skin below the dermis. Then we have our sebaceous glands. We mentioned those. Those are those oil glands, or it meant candle wax. So that waxy kind of material. We had already defined that one. And then a wheal. A wheal is small, itchy swelling of the skin. Let's look at some disorders of the skin now. So dermatitis. Dermat is the root. Itis is that suffix that means an inflammation of the dermis that can be caused in many different ways. One of those could be an allergen. Allergens are substances that cause an immune response, but they don't, in most people it does not cause an immune response, but in some people it can cause an immune response. So poison ivy, poison oak, latex, nickel. There's certain cosmetics, lotions, soaps, even clothing fibers that people are allergic to. I'm allergic to nickel. I can't wear a necklace that has nickel in it, or I get that dermatitis. I get a nice little ring of dermatitis wherever that necklace used to sit. So anything that comes in contact with that specific area that somebody's allergic to is going to develop dermatitis. Here, it'd help if I spelled it right. Let's try that again. Pruritus. Pruritus. This is a word for itch. A lot of people with dermatitis also have pruritus. They have that itch. Itis is inflammation. And then that root word tells us where that inflammation is found. Eczema. Another type, another word for inflamed, itchy skin conditions. Someone who has eczema, they usually have a very itchy red rash, and it usually contains that some sort of serous fluid that can become kind of crusty or scaly onto their skin. Excoriation is scratch marks. So if you've ever scratched your skin, had a dog scratch you, cat scratch you, and they leave these red marks on your skin, that's an excoriation. There's different types of dermatitis. Contact dermatitis is a result of direct contact with some sort of irritant or allergen. Irritants can be soaps, detergents, cleaning products, solvents. There's people that are allergic to like the perfumes that are found in certain laundry detergents, and it causes that contact dermatitis, these rashes to break out. We have atopic or allergic dermatitis. This type of dermatitis is caused by allergens that include nickel and jewelry. Perfumes, cosmetics, poison ivy, and latex. Seborrheic dermatitis. This produces a red rash that's going to have like this yellow or oily kind of scale to it. It is common in people with very oily hair. You can also see it in newborns. A lot of times those sebaceous glands, when a newborn is born, are not fully functional, so they kind of get this yellow crusty kind of scale over their scalp. And then we also have stasis dermatitis. This stasis dermatitis, it happens in the lower leg. And it's when these varicose veins slow the return of blood. And so blood starts to accumulate in those vessels. And it kind of interferes because of that swelling of blood. It interferes with that nourishment to the skin. So the skin getting enough of the blood to get enough oxygen and nutrients to survive. So why is sunlight a danger to skin health? I mean, we mentioned sunlight gives us vitamin D, but it can cause burns. Too much or not using sunscreen can cause a burn. It can also, as I had mentioned, damage the DNA in those cells, which can cause cancer to start to develop. So we had mentioned some of these words. The root, all, means strange or other. And the root erg, I wanted a different color, sorry. Erg means work. Gen, the last part of the word, for the first one here, Gen means producing. So the two adjective terms from those listed are allergenic and allergic. They have this common suffix ick, ick, ick. This means pertaining to. So let's look at some different types of skin cancers. We have malignant melanoma. Malignant melanoma is a type of cancer that is formed from the cells that produce melanin, because they have melon in there, or that melanin. This type of cancer, it usually begins as an irregularly black shaped mole. And the malignant melanoma is out of all the different types of skin cancers, it has the highest rate of metastasizing. So these cancerous cells break off, go somewhere else in the body. Exposure to sunlight, tanning beds, overexposure can cause malignant melanoma. There's other types of skin cancers here. We have basal cell carcinoma, which comes from that basal or bottom layer of cells in that epidermis. This is the most common type of skin cancer. It's the least dangerous, and it does not metastasize, which is why it's not as dangerous. We also have squamous cell carcinoma. Squamous cell carcinoma comes from cells in that middle layer of that epidermis. This can metastasize and travel other places in the body. It is named for the type of cells that make up our skin, which are known as squamous cells. So let's look at these different terms. Malignant. Malignant is a tumor that invades surrounding tissues and metastasizes to different organs. Melanoma, that's that malignant neoplasm or cancerous mass formed from cells that produce melanin. And then that metastasize. Metastasize means to spread to distant parts. Pressure or decubitus, when a patient lays in one position for a very long period of time, blood supply is cut off to that area. And when there's no blood supply to that area, your immune system isn't functioning very well, which allows pathogens or different germs, bacteria, virus, to get into that area, and it can cause the skin to start to break down. These decubitus ulcers or pressure ulcers are prevented by keeping skin clean and moving a person that is on bed rest every 2 hours. A congenital lesion or nevus, it's a birthmark. It's an abnormal pigmentation or proliferation of blood vessels like a port wine stain on the back of the neck. It usually resolves in the first few years of life, or a blue-gray benign flat Mongolian spots on the lower back. Those kind of blue-gray benign flat Mongolian spots on the low back, you'll see that more in Asian populations. So if we look at decubitus, we have a prefix of D and a root of cubitus. A nevus is another word for mole or a birthmark. These are usually pretty genetically determined. So different disorders of the skin have different types of infections. They can be viral. They can be fungal. They can be parasitic, or they can be bacterial. Some viral infections. Human papillomavirus. This is a virus that can cause warts. What this virus does is it invades the epidermis, and it's going to cause warts to form. The varicella zoster virus or chickenpox, herpes varicella zoster is another word that's usually used for it. People who have had chickenpox, that virus likes to hide out in nerves. Some kind of stressful event happens and it reactivates this virus, which is going to cause shingles to occur along the path that nerve follows. It's very painful because it's in a nerve. It can be pretty itchy. If anyone's ever had chicken pox, those are pretty itchy. Most people nowadays are vaccinated from chicken pox, that varicella zoster virus, but older generations are not. So having shingles by reactivating that virus is something that can happen. This virus is extremely contagious. So if you've never had chicken pox, you've never gotten vaccinated from it, you're more likely to catch shingles and it'll turn into chicken pox on you first. These words, macule, papillomavirus, papule, and veruca are sizes of different lesions on the skin, and then an example of one. So, macule. This is a small, flat spot or patch on the skin. This is a virus, papillomavirus. It says virus right in the name. It causes warts. And it's also associated with cancer. Papule. A papule is like a pimple. So it's an elevated circular lesion on the skin. Brucella is a wart caused by a virus. Tinea. Tinea is a type of fungal infection. It's a group of different skin-related infections. So fungi, these are found in the non-living stratum corneum. And its derivatives, we have some that live for hair, some of it in nails, like Tinea pedis for the foot. This is known as athlete's foot. We have Tinea capitis is in the scalp. We have that Tinea purpuris is in the body. There is Tinea cruris, which is in the groin. And then we have Tinea versicolor, which is in the trunk or body. Candida or thrush is also a fungal disorder of the skin. Candida can cause recurrent infections. A recurrent infection caused by Candida is this thrush. It's seen a lot of times in infants who are bottle fed, patients who are on chemotherapy, patients who use asthma inhalers and don't rinse their mouth afterwards can develop this thrush. They usually get this white kind of hair-like growths on their tongue and their palate, so that back of their mouth. Parasitic infections. A parasite is an organism that lives in contact with and feeds off another organ. So this organism just lives off of you, lives off of this person. They don't contribute anything. They just take. An infestation is different from an infection. An infestation is a parasitic attack or substance on the skin and its appendages, while an infection is a disease caused by a microorganism that releases toxins or invades the body. So let's look at infestation. Our root word is infest, which means invade. Ation is that, suffix, which means process. We also have the word infection. Infection, the root is infect, which means invasion, and that suffix, ion, means action. So by breaking apart these words, you can figure out what they mean. Lice is a type of parasitic infection. They are small, living little parasites that require a host to live. Pediculosis is the name of the disease caused by an infestation of lice. Our root, pedicule, means louse, while that suffix, osis, means condition. An itch mite is another parasite that comes and lays eggs under the skin. This causes the infestation known as scabies. Scabies is usually a very intense itching rash. A Staphylococcus aureus or staph infection is a type of bacterial infection. This can cause pimples, boils, carbuncles, and impetigo in the skin. So it gets in, invades in pimples, it invades those sebaceous glands, causing them to get infected, and that's what causes those pimples to form. Carbuncle is an infection of many hair follicles. In a very small area, often on the back of the neck. Indigo is an infection of the skin that produces this thick yellow crusts. And then we have scabies. This is from mites that have laid those eggs under the skin. SLE and rosacea affect collagen. Collagen is a type of protein that is found again in our skin. It's found in that dermis. So these collagen diseases attack the collagen or other components of connective tissue. So systemic lupus erythematosus is an autoimmune condition, and it occurs in women more than it occurs in men. It's going to cause this kind of butterfly-shaped rash across the nose and the cheeks, is one of the skin manifestations of it. It also damages the kidneys, it causes liver problems, it can cause a lot of digestive problems, but it's attacking collagen. So we have collagen in our skin, we have collagen all over our body. So it's affecting that collagen everywhere in our body. Rosacea is a rash. It does produce a rash that is similar to SLE, but it's caused by enlarged capillaries. Again, we have collagen in our blood vessels a lot of the time. So the difference between rosacea and that SLE is that lupus is autoimmune, so your own immune system is coming in and attacking that collagen. Rosacea is not autoimmune, so it's caused by some other factors. Scleroderma. Scleroderma is a chronic, persistent autoimmune disease that is caused by hardening and shrinking of the skin that makes this, and it starts to make that skin feel more leathery. Scleroderma affects women more than it does men. It usually, besides the skin, it's also going to go after the heart, the lungs, the kidneys, most of the organs of the digestive tract, along with joints. Scleroderma is also kind of associated with breast cancer. Psoriasis is this itchy, flaky, red patches of skin of different sizes that it's usually covered by this white scaly type of appearance to it. Vitiligo. Vitiligo produces pale, irregular patches in the skin. So while this is scleroderma, these white patches that we kind of see in here, this whitening of the skin, is also characteristic of vitiligo. Vitiligo has no cure, while psoriasis does. So let's work on pronouncing. Psoriasis. Psoriasis. Rosacea. Rosacea. Scleroderma. Scleroderma. Okay, let's go into the accessory organs of the skin. I mentioned those hair follicles. So here we're going directly into those hair follicles and sebaceous glands. Those sebaceous glands secrete this oily sebum. As seen here, these sebaceous glands. There's many different hormones that triggers excess production of sebum. That is also known as androgens, which are the male hormones. Females do get androgens through a gland that sits on top of their kidneys that produces this specific hormone. Males will get these hormones from their testes. Acne. Acne, those hair follicles get blocked by too much sebum and broken down keratin cells from the base of the hair follicle. This forms a comedo, which, if ruptured, it allows bacteria to enter and it forms a pustule. People are particularly prone to acne between the ages of 12 to 25. Cyst. A cyst is an abnormal fluid-filled sac surrounded by a membrane. Comedo is a whitehead or a blackhead that is produced when too much sebum and too many keratin cells block the hair follicle. Pustule is a small protuberance on the skin containing pus. Seborrhea. Let's look into seborrhea here. It's an adjective. We have the suffix "ria" That means to flow. Our combining form, sebo, means sebum. So seborrhea means excess amount of sebum. Hair. Body hair, well, this says there's no specific function to it. Sometimes there is somewhat of a function to body hair, like the hairs on your arms. If there's some bug flying into the hairs in your arms, there's nerves that are attached to those hair follicles that allows you to know that hair is being moved and you can swat something away. Alopecia is thinning of the hair. Axillary hair is found under the arm. Hair during the evolutionary process was thought to provide warmth. Sweat glands. We have anywhere between 3 million and 4 million sweat glands all over the body. We have higher concentrations in the palms of our hands, the soles of our feet, and our forehead. Their function is to produce a watery perspiration or sweat that helps to cool the body. We have different types of sweat glands. Some produce sweat, and some produce more of this kind of milky-like substance that will produce a smell. Your nails. Onychomycosis. Your nail becomes brittle or cracked. Most nail disorders are actually caused by a fungus. And because of this, by keeping your hands moist or your nails damp, increases that fungal chance of a fungal infection. Parentia is a bacterial infection at the base of the nail. The most common bacteria that again infects your nails is the same one that infects your skin, Staphylococcus. Nails can reflect different illnesses and conditions as well. If your nails are blue, it's a sign of hypoxia, not enough oxygen in your blood. If your nails have like a spoon shape appearance, it can mean iron deficiency anemia. If they're cracked and very brittle and there's no infection in them, it could mean that there's malnutrition, not getting the correct nutrients into our system. Onychomycosis. Let's break this word down. Osis means a condition. Onco, which is that root word with that combining vowel, that combining form means nail. Then we have another root, which means which means fungus. So this is a condition of the nail from a fungal infection. Paronychia. Paronychia. We've got that suffix ia means condition. That root we go, which means nail, and then we have a prefix this time. Means alongside. That the root is technically para, but we drop that second A to make the composite word flow more easily. So diagnostic and therapeutic procedures and pharmacology of skin disorders. So Diascopy is a microscopic slide is pressed against a lesion to see if it blanches. This is helped to tell us if it's some sort of vascular lesion or not. A microscopic examination is where we take skin scrapings to help diagnose a fungal infection and scabies. Cultures is where we swab lesions which are implanted on these growths to different media to diagnose different viruses and bacteria in the skin. Photodynamic therapy uses this high intensity blue light to create a toxic environment where bacteria cannot live. Laser therapy is used to manage birthmarks, warts, and vascular lesions. Chemical peels use an acid solution which is applied to the skin to reduce these fine facial lines and wrinkles. Cryotherapy, I'd mentioned this one before, using cold, but another way for cryotherapy is using liquid nitrogen spray to treat acne, scars, and sebaceous plaques. Dermal fillers helps diminish fine lines and wrinkles. We've got different topical agents. We have anesthetics, which relieve pain or itching on the skin surface. Antibacterials eliminate bacteria that cause skin lesions. Antifungals eliminate or inhibit the growth of fungi. Antipyretics relieve itching. Corticosteroids. Keratolytics peel away the skin stratum corneum. Parasiticides, these kill parasites like lice. Then retinoids treat acne, sunspots, and psoriasis. So let's look at burns and injuries to the skin. So a first-degree burn. A first-degree burn is also known as a superficial burn. We get first-degree burns from prolonged sun exposure or short exposures to hot surfaces, like a hot stove. First-degree burns require no medical attention and they don't really leave scarring because they only go through this epidermis, this first layer of skin, and these cells can reproduce themselves very well, which leaves very little scarring. Second-degree burns. A second-degree burn involves this epidermis and the dermis. Second-degree burns are also known as a partial thickness burn. They require medical attention and they may produce scarring because this dermis here cannot repair itself as well as this epidermis on top. That's why scarring may happen. In a second-degree burn, you may see redness, you can see blisters, and will see severe pain because of all of these sensory receptors we see in that dermis. A third-degree burn. A third-degree burn involves the dermis, or the epidermis, the dermis, and then this bottom layer, which is known as that subcutaneous tissue. This third-degree burn is also known as a full thickness burn. It's going to require medical attention, and usually it involves skin grafting, where they take skin from one area of the body and transplant it to this other area of the body so the skin can regrow. And then we have a fourth-degree burn. Fourth-degree burns are going to destroy all the layers of the skin. It's usually going to involve tendons, muscles, and sometimes even the bones. A fourth-degree burn can be from an exposure to high voltage electricity. Burn injuries to the lungs from heat or smoke can cause 60% of burn fatalities. Again, skin grafting is required because it goes through tendons, muscles, and bones. So that's everything under the skin. This is where we use a rule of nines to determine how much of the body is burned. The head and the neck is considered 9% of the body, 4.5% for the front, 4.5% in the back. Each arm is 9%, so 4.5 again for the front, 4.5 for the back. The legs are 18%, 9% in the front, 9% in the back. And then that perineal area or that genitalia area is 1% of the body. A lot of times when you have burns, you're going to see edema. Edema means swelling. Edema is the noun, while edematous is the adjective. Inflammation is that noun. Inflammatory is the adjective, which means a complex of cells and chemical reactions occurring in response to an injury or chemical or biologic agent. So let's look at some words here. Auto, self. Homo means same or alike. Allo means other. Xeno means foreign. And hetero means different. So all of these words shares this common root, graft, and it means transplant. So autograft means we're transplanting the same, or the tissues from that same person. Homograft means alike or similar person. Allograft means other. So we're something else, transplanting something else. Xeno means we're transplanting something foreign. Hetero means we're transplanting something different. So a laceration versus an incision. A superficial laceration, like a shaving cut, those epithelial cells along the edges divide and rapidly fill in the gap to heal it. So these cells right here are going to come and fill in this gap and heal this area. This is a deeper, this picture here shows a deeper cut or wound. Or the skin could even be in size. This could have been from an incision down. Blood vessels in that dermis tend to get broken, so blood is going to escape. What's going to happen is we're going to form a clot with this blood to prevent further damage from happening and to kind of fill in that space as this tissue repairs itself. So here's that scab formation. So after a clot forms, macrophages. So these are blood cells, white blood cells are coming into this area. And what they're doing is they're cleaning up any kind of debris, anything that may have gotten in when the skin was damaged. The surface of this clot's going to dry and harden from the air. It forms this scab at the surface of the skin. The purpose of a scab is to protect that wound, to prevent it from further infection, from any infection. So after 3 to 4 days, this clot is invaded by new cells that are forming new collagen fibers. All of these pink lines here that you see, these are collagen fibers that are coming into this area. They're going to work their way into this area and they form what is called granulation tissue, which is then going to form a scar. This scar, we're going to see a scar as long as this dermis here is affected, because these collagen fibers can't come in and come 100% repair this tissue. So this is what causes that scar to form. Suturing or keloids. Suturing is that manually bringing the edges of the wound together. So they usually use non-absorbable or absorbable or even a liquid adhesive to bring that skin together. If you've ever had stitches before or had surgery where they use like skin glue, that's bringing everything together. A keloid, this picture right here, is excessive fibrous or that scar tissue forming outside of that wound. It causes that raised scar, and it can be kind of lumpy or bumpy kind of appearance to it. This is excessive scar tissue forming, possibly from an ear piercing. That's just my guess from the picture and location. So all of these words share the common suffix of plasty. Plasty means surgical repair. So an abdominal plasty, it's a tummy tuck. Blepharoplasty, has to do with defects in the eyelids. Mammoplasty is altering the size or shape of the breasts. Rhinoplasty is altering the size or the shape of the nose. So the skin, as we said, is the largest organ in the body. We went through all the different structures of the skin, how to diagnose and treat, and some of the different treatments that are used. And your skin is that first line of defense against allergens, pollutants, and everything out in the body. Thank you very much for listening and have a wonderful day.